And today we are looking at posology. So, posology is a branch of pharmacology which necessarily deals with the dosage of drugs. Okay, so now let us also understand some terminologies that can be used in pharmacology as we appreciate the topic of posology. So, the first definition we're going to look at is a drug. So a drug refers to any substance that brings about a change in a biological function through its chemical action. So when you're looking at a drug, you're just looking at any substance, that if introduced within the body may bring about change in the physiological function because of the action of that chemical or because of the action of that substance. A drug, we are looking at it as a substance that may cause a physiological effect. Okay, so that is what we look at as a drug. Anything that, if introduced within the body or introduced on the body, may cause alteration within the biological function or may bring about a chemical action. That is what we look at as a drug. For this lesson, our definition of a drug, we are just looking at it as any substance that brings about change in a biological function through its chemical action. So when say through its, which one? That is the same substance or drug bring about it, the chemical action. Then when we say prodrug, this refers to compounds that on administration must undergo chemical conversion by metabolic process before becoming an active pharmacological agent. Some examples that I would give here is levodopa, okay, being changed into dopamine. Okay, so you take levodopa, when it's in the body, it goes under some metabolic action and is changed to dopamine. So when you're looking at a prodrug, you are just looking at a compound or you're looking at a substance, okay, that when administered in the body, it has to go through some chemical conversion. It has to be converted so that it becomes an active drug. How is it converted? It is converted by metabolic processes within the body so that it now becomes an active pharmacological agent. So that we call a prodrug. An example here is levodopa, placebo. So when talking of placebo, we are necessarily referring to an inactive substance or preparation that is given to satisfy the patient's symbolic need or psychic need. It is given to satisfy the patient psychological need. Okay, so that is for drug therapy and is used in controlled studies to determine the efficiency of medicinal substances. So a placebo is an inactive substance. Okay, so it is not giving you therapy. Okay, it's neutral. It's not giving you therapy, but it is given so that we satisfy a psychological need. Okay, so that we can appreciate or determine the efficiency of medicinal substances. Because there are instances where, because of certain psychological feeling, someone may feel they've been cured by the drug, but because of the psychological attachment that has been publicized about the drug, so they may feel it's a drug which has worked. So we want to differentiate the efficiency of the drug chemical action and the placebo, which is not bringing about a chemical action to provide cure. So a placebo necessarily refers to an inactive substance or preparation that is given to satisfy the patient's symbolic or psychological needs for drug therapy, and it is only used and will be used in controlled study to determine the efficiency of medical substances. Okay, so there can be blinded study, double-blinded, single-blinded studies. Okay, so that even the person who is administering doesn't know that what they are giving is a placebo. Let us now define a dose. A dose is an amount of drug taken each time by an individual, or a quantity could be administered at one time. So that is what we call a dose. So we're looking at an amount of a drug that has to be taken at each and every time. So drugs are taken, let's say 6 hours, every after 6 hours, can be taken every after 6 hours, then meaning that's 4 times a day. Every after 8 hours, that will be 3 times a day. So that drug that you are giving at each and every time is what we call a dose. Okay, so example, let's say paracetamol 500 milligrams. Okay, you can talk of let's say flagyl 400 milligrams. So 20 milligrams, 10 milligrams, 2 drops, and the likes. So that is a dose that you are giving at that particular time. Okay, so that quantity which you are administering, which you are giving at that one time, is what we call a dose. So now when we say dosage, we are looking at the amount of drug given to an individual per unit body weight, or the determination and regulation of the size, frequency, and number of doses. When you're looking at dosage, we are necessarily looking at the drug that is given to an individual per unit body weight, or the determination and regulation of the size, frequency, and number of doses. Here, for example, when we are giving quinine is like given per kg body weight. So you have to take into consideration the weight of the patient for you to arrive at the dosage, to arrive at the amount that is should be given to that individual. So you calculate, okay, so the unit body weight, okay, or when talk about the unit body weight here, you take the patient's body weight into consideration. So we can see that within formulas, when you're trying to calculate dosages, you may need to input in maybe the age or the weight of the patient so that you can find the appropriate dosage. Okay, so dosage is just about the amount of the drug that can be given to an individual per unit body weight, or determination and regulation of the size, frequency, and the number of doses. Okay, so now with that discussed, let us now appreciate dosage types. Let us appreciate the dosage types. So there's what we call therapeutic dose. So when we say therapeutic, from the word therapy, so therapeutic dose, here we're looking at an average dose for an adult to produce a therapeutic effect. Okay? So that is what we're calling a therapeutic dose. That dose which is going to provide therapy or produce therapy. So that is what we call a therapeutic dose. So that average dose is that is going to bring about therapy is what we are calling therapeutic dose. Then there is loading dose. So this is a large dose initially used to produce an effective concentration as quickly as possible. So in malaria, we have, let's say, for adults, a loading dose of 1,200 milligrams or 1.2 grams. Okay, so we can give that as a loading dose. So this one is a larger than usual dose that is given in order to produce an effective concentration, okay, as quickly as possible. So that is what we call a loading dose. So a loading dose for this discussion, we are saying it's a large dose that it will be given initially, start. Like start in pharmacology, we are talking of STAT. So start, that is the one that you are giving initial, the initial dose that you are giving. So a large dose that is given initially to produce an effective concentration is a loading dose. Initially, that is at first, at the beginning. Then there is a maintenance dose. So a maintenance dose is a dose that is used to maintain the therapeutic effect or concentration in blood plasma. So you have given your loading dose to produce an effective concentration, okay, within the blood, but you want to maintain a certain amount of drug within the blood so that the drug can continue working, removing away the, the microbes. So you need to give some maintenance doses so that that concentration of the drug is there to produce the desired physiological effects. So a dose that is used to maintain the therapeutic effect or concentration in the blood plasma is now what we are going to call a maintenance dose. Then there is maximal tolerated dose. Okay, so when we talk of maximal tolerated dose, we are looking at the largest dose of a drug that can be taken safely. The largest amount of the drug, if taken, will not bring adverse reaction or it will not bring toxicity. Okay, so what is the largest dose of a drug that can be taken? Okay, so all drugs have got the largest dose that you can take because after you take more than that, then it becomes toxic. So maximum tolerated dose, we are just looking at the largest dose of a drug that can be taken with safety or safely. Then there is a toxic dose. So this is an amount of a drug which produces undesirable harmful effect of a serious nature. So toxic, this is a dose more than the maximum tolerated dose. That if taken, it is now going to bring the undesired effect of the drug. All drugs have side effects, all drugs are poisons. Okay, so now it's about the amount of the dosage that you take. Okay, so now the dosage that you have taken reaches the toxic level. If the drug is not helping you now, starts to destroy the system. So toxic dose, you are looking at an amount of drug which produces undesirable harmful effects that are of serious nature. Then we have what we call a fatal dose. A fatal dose that produces death is called the fatal dose. So a fatal dose, this is a drug like someone who wants to commit suicide, takes 12 tablets, 15 tablets. So now those are toxic doses and they are likely to cause death. So now a fatal dose, this is a dose that is, if taken, may cause death. Okay, the determination that you take this drug may cause death. Okay, so there have been people who have used drugs before, like to help them to sleep, and they have taken a fatal dose. Okay, or they were taking toxic doses. Then, at one point, because of taking these toxic doses, they took a fatal dose. This now dose eventually causes now death because it is able to produce death. You can tolerate a drug. There can be what we call drug tolerance. You are tolerating her maximum doses. We have talked about maximum tolerated doses. You can tolerate maximum, but does not mean the body has acclimatized, okay, or is accommodating this. So this may become toxic, start to degenerate the body. So then we are saying now that becomes toxic. Okay, so now from toxic dose, it can be a fatal dose. Okay, so now in looking at the dosage types, we have looked at therapeutic dose, loading dose, maintenance dose, maximum tolerated dose, toxic dose, and fatal dose. Now let us look at dose calculation. Okay, so in our board series of lessons for pharmacology, we will do some calculations in pharmacology. Here, we just want you to appreciate the formulas that are out there when you want to calculate dosages. So dose calculation Adult dose is for a person between the age of like 18 to about 60 years. Then children are given small doses. Children may, let's say, children dose may be calculated as a fraction of adult doses. So for calculating children's doses, we have Young's formula and we have Clark's formula. So Young's formula is used to calculate doses of children that is between 2 to 17 years old based on the adult dose. So how then can you calculate a child's dose in using Young's formula? Okay, and Young's formula we are saying is applicable to 2 to about 17 years. So in using Young's formula, we are saying child's dose is equal to age in years times adult dose. So the age of the child in years, it has to be in years like 2 years, 3 years, 4 years. Okay, so age in years times the adult dose. If adult dose, let's say equivalent adult dose is 500 milligrams, then times 500 milligrams. So now this has to be divided by age in years plus 12. Okay, so using Young's formula, we say child's dose is equal to age in years times adult dose, the non-adult dose. You divide it by age in years. Okay, so the numerator, denominator, we have age in years. Age in years. So now, for the numerator, the one on top there, we are saying it has to be multiplied with adult dose. Then for the denominator, age in years, you need to add 12. Okay, so now, also Clark came up with a formula for calculating children's dose. So Clark's formula is used to calculate doses, especially for infants. Okay, that is infants are talking birth to 1 year old. So by using weight of infant in like pounds. So infant dose using Clark's formula, infant dose is infant weight in pounds times adult dose, then you divide by 150. That is the way you find the infant dose. Infant, that is children that are below, that is birth to 1 year old. So that is below 1 year, 1 year and below. So infant dose. So infant dose, we are looking at weight in pounds times adult dose. Okay, divide by 115. So now, when you are doing pharmacology calculations, it's important when we say child's dose, according to Young's formula, age in years. Okay, when and we are saying it is for children between 2 to 17 years. Okay, so for this one, it's important that when we say age, specifically it has to be in years. Okay, so it specifically it has to be in years. Now, when you look at an infant is less than 1 year. So here we are talking about months. So instead of now using the months in the Clark's formula, we are saying infant weight. So we are concentrating on using the weight times the adult dose. So in Young's formula, we are saying age in years times adult dose, but in Clark's formula, we are saying weight times adult dose. Then you divide by 150 according to Clark's formula for infant doses. But for Young's formula, it will be age in years plus 12. This is the one that you are going to divide into the age in years multiplied by adult dose. Okay, so if you are working in a children's ward and you are dealing with infants, you know you have to be very familiar with Clark's formula in finding the dosage. You have to use it frequently to find it. Then, if you're working with children that are more than 1 year, you have to familiarize yourself with the Young's formula and do a lot of calculations. So, with calculations, what is important is that if you start practicing, you try to replace within the formula. Okay, the best way in mathematics when you're calculating, first you write the formula, then replace with the figures. Okay, so it's that when you now replace with figures, you practice, then you'll be able to master. all this. So now let us now look at factors modifying the action and dosage of drug. Factors that are modifying the action and dosage of a drug. So many factors influence the dosage and action of drug. If the drug is too small, the drug will not produce the desired action. If it is too large, it will produce toxic effects, which are not desirable. So following are important factors which influence the action and dosage of a drug. Here it is important to note that in as much as the drug, the tablet may seem small, the potency, the power of the drug is in the milligram of the chemical that is there, the milligrams. So Piriton may be 2 milligrams, Piriton may be 4 milligrams. It may look very small, okay? But you take 12, you are taking, like, let's say you're taking 12, you're taking more like 4 milligrams times 12, okay? So that is the thing. So the power of the drug is in the milligrams that are there. It doesn't matter how small the tablet looks, but the milligram of the chemical that is going to bring about the effect on the body. So that is what is important. So now, right now, we are trying to appreciate the factors that may modify the action, modifying the action of book and the dosage of the drug. Okay, so what are some of these factors that we need to look out for? Age. Okay, so age, if you cannot, so when you talk of age, you cannot give an adult dose to a child. Okay, so when you look at the proportion of the body units and that of an adult, and that of the baby, there is a big difference. So we are saying some of the factors that may modify the action and the dosage of the drug includes age. So apart from age, there is body weight. Body weight, we calculate the dosage using body weight. Sex, okay? When you talk of deposition of fats and the likes, according to male and female, there is a difference. But I'm going to amplify this. Then routes of administration. Routes of administration is what we dealt with when we started the pharmacology, and we have recorded the lesson on that. So routes of administration, there is oral, or there is enteral, and there's parenteral, and then there is others. Okay, so routes of drug administration, time of administration, dosage form, absorption, distribution, and excretion of the drug, pathological condition, tolerance, and lastly, combination of drug. Okay, so in terms of combination of drug, it can bring about some synergism and antagonism. Now, let us expand these modifying factors that may affect the dosage of a drug. Let us see. Let us discuss them in detail. So when we talk of age, adult dose is for a person between the ages of 18 to 60 years. Children at even small doses. We use Young's formula and Clark's formula to calculate dose for children and infants. Okay, so we are using Young's formula for children, Clark's formula for infant, respectively. So above 60 years of age, the dose should be decreased. That is to three quarters or three quarters of the adult dose. Here is because metabolic processes in the elderly they become slow. So giving them a normal adult dose, okay, may bring some more idiosyncratic or some they may bring about some some side effects and desirable effects because the metabolic process have become very slow. Okay, but tampering with the doses, it may depend on your clinical observation, and you may tamper with the dose and reduce. But otherwise, when you're talking of adults, the age is between 18 to 60 years. Okay, here the doses, like for adult doses, can be tolerated nicely. Okay, and then when you want to give children, you use Young's formula or Clark's formula. Then uh, there is the body weight. So for body weight, for abnormal body weight, the dose of the drug should be suitably adjusted according to the weight of the patient. So some drugs are given according to body weight, or drugs are given according to body weight. Okay, so body weight, we are saying for abnormal body weight, the dose of the drug should be suitably adjusted. You are giving insulin and you are giving the kg body weight. So suitably, you need to adjust the dosage. Okay, because again, if you give too much of the drug, because you have seen that the person is overweight, you may give an overdose. Okay, but adjust it accordingly. Then to do with sex doses for the women should be less than okay, so should be less than man because women are usually having more effect than that is more effect than men. Okay, so now to do with doses for women should be less than man because women are usually having more effect than females. Okay, we just necessarily give the dosage the same way unless otherwise some situations like a woman is pregnant, okay, a woman is breastfeeding, and such, you may require to temper with the dose. Okay, all right. So adults, whether male or female, to do with sex, but what is important for you to note is that there is a difference in fat distribution in male and females. Okay, so the drugs for females and male adults, they will necessarily have to be given almost the same way, unless otherwise in situations where there is some reactions, then that's when the dosage may need to be tempered with. And particular situations to do with the issue of sex is a woman who is pregnant, a woman who is breastfeeding, and the like. So, pregnancy, menstruation, and lactation period should keep in mind while adjusting the dosages. Okay, so that is to do with the issue of sex. So, adults, whether male or female, the dosages will be the same. That is between 18 to 60 years. Then, routes of administration. When a drug is given intravenously, onset of action is rapid. Okay, is rapid. Orally given drug have slow onset action. So oral dose of drug always greater than when it is given parenterally, and dose for subcutaneous or intramuscular injection is greater than intravenous. So, according to the route of drug administration, we have established that when you give drugs intravenously, okay, the action is rapid because it is available within the blood to be used by the receptor. So it's easily available. But when it is passing through the oral route or the enteral route, okay, it may also have, let's say when you talk of oral route, there is the hepatic phase where the liver has to now work on the drug so that it is made available to them into the blood. So that affects the dosage. Okay, so according to the route of administration, we are saying to modify the effect of the drug, you give IV. IV for rapid action. Okay, then time of administration. Presence of food in stomach delays the absorption of drug onset action. Okay, and it's going to be slow. Some drugs can actually cause irritation, nausea, and vomiting while given in empty stomach. So when you talk of hypnotics, they are more effective when given at the bedtime. So drugs sometimes also come with instruction taken before meal, or should be taken before meal, or should be taken after meal. Okay, so mostly this is to allow for absorption or to reduce on some adverse effect. So when you give certain drugs that are supposed to be taken before meals, okay, they may be affected by the meal because you have taken after a meal. All right, so that is to do with time of administration. Drugs, when they are given they have time when they're supposed to be taken. Okay, so that immediately the other amount concentration has reduced, then the other drug will now go to beef up the concentration so that the therapeutic dosage or maintenance dose within the blood, the plasma is maintained. Then we have dosage form of drug, the dosage form of the drug or preparation. Onset action is rapid when the drug is given in liquid or as powder as compared to drug given in form of a tablet or pill. So the drugs that are in liquid form can easily be absorbed. So the onset of action is likely to be faster, okay, unlike when they are taken in tablet form. But this does not mean that all drugs can to be prepared in liquid form and the likes. There are main reasons within pharmacology as to why some drugs will be available in capsule form, why other drugs will just be available in tablet form, and why other drugs can be available only as intravenous. Then, absorption, distribution, and excretion of the drug. So, drugs which are rapidly absorbed and excreted quickly cannot maintain effective concentration for therapeutic effects. If you take a drug and then it can be quickly excreted, then it will not work within the blood on the receptors to bring about the therapy that it will require. So drugs which are quickly absorbed but excreted slowly may produce a toxic effect. So suffices to say that if you also take a drug which takes long to be within the body, like it will take 1 month for it to, to come out or to be excreted, may cause a cumulative toxic effects. So once when you're taking the drugs, okay, within a moderate space of time, this drug is excreted from our body. So when talk of absorption, distribution, and excretion of the drug, drugs which are rapidly absorbed and excreted quickly, okay, cannot maintain effective concentration, okay, for therapeutic effect. And then those drugs which are quickly absorbed but excreted slowly may also produce what we call a cumulative toxic effect. Then other things that may modify the drug is okay, and the drug dosage is a pathological condition. So when liver or kidneys are not functioning properly, which are involved in the excretion of the drug, in the metabolism of the drug, kidneys are involved, the liver is involved. So we are saying the dose should be decreased to avoid toxic effect. If someone has a pathology within the liver, has a pathology within the kidney, the dosages may need to be reduced. Okay, let's say someone is having a liver problem and you give paracetamol. Some of the side effects to do with paracetamol has to do with may cause liver damage. So what we are saying is you may need to reduce the dose or necessarily don't give. The liver is involved in metabolism of a lot of drugs. So when it is diseased, you find that the modification of the drug dosage may be modified because the liver cannot metabolize the drug normally. Then we move on to the issue of tolerance. Okay, it is unusual resistance to ordinary dose of the drug. Increase the dose is often required to obtain a desired therapeutic effect. So when you're talking of tolerance, you are necessarily looking at an unusual resistance to ordinary dose of the drug. So increased dose is often required actually for someone who has got tolerance to obtain desired therapeutic effect. For someone who takes alcohol, they become tolerant to drugs that are given in theater. So we may give them the usual dose, they may not feel the relief that they need. So why? Because they have been abusing alcohol. So when you have been using a certain product, drug or substance, you may develop a tolerance that the usual dose may not bring the therapeutic effect. It is just like someone who takes alcohol. You cannot take one bottle of beer every time, okay, and get drunk. At one point, because of the issue of tolerance, one bottle of beer will not cause you to be drunk. You may need a larger dose. Let's say you may need two, Okay, you may need 12. Okay, so but even when you need all these, you need to know that you may reach toxic levels, okay, of your requirement for this. All right, so today we were looking at posology, which is a branch of pharmacology more interested more interested with the dosage of drug. So posology, a branch of pharmacology that is more interested or whose interest is in the dosage of drugs. So after defining posology as a branch of pharmacology, we now looked at the definition of terms. We defined a drug, okay, which is merely a substance that may alter biological function, okay, because of its action. We looked at the prodrug, okay, substance or compound. When administered, it requires for it to be converted so that it becomes an active agent. We have looked at a placebo, which is merely an inactive substance, okay, that is taken to satisfy a psychological need, and also determining the efficiency of medicinal substances. We have looked at a dose as merely a drug taken at each time, okay, by an individual, or quantity of drug that can be administered at one time. Okay, so at each individual time when someone takes, or that it can be taken at one time. Then dosage, we are looking at amount of drug that can be given to an individual per kg body weight or per unit of body weight. That is the dosage. Why? Because we need to calculate the dosage of the drug according to body weight. Okay, so when we calculate, we are going to come up with the regulation, okay, the frequency and the number of doses. Then we have also discussed dosage types. Okay, so dosage types, we have therapeutic dose, loading dose, maintenance dose, maximal tolerated dose, toxic dose, and fatal dose. Okay, so those are the ones that we have. So to understand them, even by the words the words themselves, when say therapeutic, okay, they are trying to give us a clue on what it is meant. When say loading dose, they start the usual, let's say a large dose that is initially given, okay, so it is a large dose that is given initially or as the start. Maintenance, we want to keep a certain amount of drug within the blood, okay, so that we produce therapy, the maximum tolerated dose, and toxic dose, and then the fatal dose. Then we have also looked at some formulas that can be used to calculate dosages. Okay, so we have Young's formula for 2 to 17 years, okay, where you use 18 years times adult dose over 18 years plus 12. Then Clark's formula for infants, that is infant's weight in pounds times the adult dose, okay, over 150. So when you look at all these formulas, it's important that you know that when you use unit as weight, you need to know how to convert to pounds when you're using a Clark's formula so that you can find the right dose. Okay, so that is how it is done. So to best understand this, I have said we are going to have lessons that we are going to use the board lesson series to explain how to calculate this. Okay, so it's important to know when to convert and the units that are required. Then factors modifying the action and dosage of the drug. We have looked at age to say it can be a factor that may modify the action and dosage of the drug. The body weight, sex, route of administration, time of administration, dosage form, absorption, distribution, and excretion. Okay, and then the pathological condition, tolerance, and the combination of drugs. So these are some of the things that we have looked at, and we expanded these factors to give them more meaning as to how they can modify the action and dosage of a drug. So that has been our lesson on posology, so that we appreciate drug dosage. So thank you very much for listening, and keep studying.